Precision oncology is the future of cancer medicine. It essentially uses a molecular view of cancer as a disease to both design better treatments and to understand better who is likely to develop cancer and what we can do about it. So precision oncology can be divided up into treatments and essentially risk management. So for adolescents and young adults with cancer, because their numbers are typically small, the cancer types may be quite rare, precision oncology offers the opportunity to personalize treatment to that particular cancer when you don't have large randomized studies of thousands of patients to go by. But one of the messages from my talk tomorrow will be that I think the biology behind cancer in young people is somehow fundamentally different, or frequently fundamentally different from the cancer that we see in the bulk of the cancer population, where the median age of onset of cancer is 67 years in the Australian community. So what that means is the treatments we've developed for precision oncology have been designed for a set of diseases with different molecular characteristics, and we haven't yet reached the point where we understand the unique biology that applies to adolescents and young adults and the treatments that we need to bring to that population. The second message is about understanding what happens to adolescents and young adults after they've been treated for and cured of cancer. And that's using things like whole genome sequencing to understand why they got the cancer in the first place, and in their survivorship to use the same genomic information to understand a little better what sort of challenges they're going to face in the years ahead of them. Cardiovascular disease, dementia, drug reactions and so forth are all opportunities that we have if we use genomic sequencing to understand why they got the cancer in the first place, to have secondary gains for those patients over the rest of their lifespan. So I think we're going to see a big change for adolescents and young adults with cancer. We're going to see a focus from the disease and treating the disease itself to potentially thinking about the very large number of survivors of adolescent and young adult cancer who are out there in the community and for whom we don't yet have a way of, we haven't developed an approach to looking after their wellness in the remainder of their lives.